Well, hello everyone. Today is May 23rd of 2022, and I'm here with Professor Kalinga Tudor Silva, and I'm going to hand it over to you, Professor, if you could introduce yourself and also tell us about your work.
Thank you, Emily. I'm a professor in Sri Lanka. I'm a researcher and a teacher. My background is in sociology and also to some extent public health. So my previous work has been on social aspects of malaria. And also we have a new disease called chronic kidney disease of unknown etiology. I have done some work on it before, getting involved in the COVID related work.
Wonderful. Well, thank you so much for your time today and for sharing a little bit about yourself and your work. So then kind of looking back, what were you doing in December of 2019 and how has your work and your research shifted given the spread of COVID-19 then in the spring of 2020?
Yes, 2019 December, actually I was involved in a study abroad program for US students coming to Sri Lanka. That program was actually called Intercollegiate Sri Lanka Education Program. We brought undergraduates from several colleges in the US to study in Sri Lanka. That program was stopped because of the pandemic. Students stopped coming. So, that part of my work ended. But since then, to respond to your question about how the pandemic affected my work involves two broad areas. One is teaching and the other one is research. Teaching was severely affected because students could not come to the university. So we had to switch to online education for the most part. And online education in Sri Lanka is quite difficult because there are a lot of people, a lot of students without proper access to internet, and some without access to devices. So we had to switch to online mode, but we had to deal with a lot of difficulties in the process. With regard to my research, again, this was severely affected because couldn't do any field work because of lockdowns and pandemic-related restrictions. So there again, we had to switch to online mode for the most part. For instance, I did a couple of online surveys about people affected. My primary research involvement on COVID was on the role of faith actors during the pandemic in Sri Lanka. So that work had to be done primarily through the online mode. Like we did key informant interviews using a mobile phone and WhatsApp, and then online survey. So that's how my work was affected by the pandemic.
Thank you so much for sharing that. And then kind of looking more closely at this research with faith-based actors, could you describe a bit more about that and maybe any larger takeaways or kind of set us the scene for what your research was most focused on?
Yes, that's a good question. Actually, the faith actors played a very important role during the pandemic, particularly in the later stages. But initially, there was, considerable mistrust among religious communities, partly drawing from previous, ethno-religious tension in the country. So there was a lot of hate speech and, some people being accused of being super spreaders of the disease, particularly minority communities. So there was quite a bit of tension and misunderstanding during the early phase of the pandemic. But as the pandemic progressed, people gradually realized that this is a common, disaster, and everybody had to deal with it. And also, religious actors played a very important role in two ways. Actually, one is promoting public health activities, particularly vaccination coverage. There was some resistance, particularly from minority communities. So the faith actors work with public health people in providing education about vaccination. And I think vaccination uptake increased substantially as a result. And the other area where faith actors became heavily involved was relief and humanitarian action, for people affected by the pandemic, people who lost their livelihoods and sometimes family members. So the faith actors played an important role in providing counseling, assistance, raising funds, and also often what I noticed was that their assistance was not limited to followers of their own religion. They often it extended beyond their own religions, and so that I thought was a very important step towards basically avoiding mistrust and promoting mutual understanding among communities. So these are some areas where they played a critically important role.
Thank you so much for sharing that. That's very interesting to hear about and important. And then kind of thinking about communication in these roles, and also I know you mentioned that you did a bit of research on stigma and discrimination. Could you speak a little bit more about those aspects and those issues that were surrounding COVID-19 in Sri Lanka?
Yes, stigma and discrimination was once again very important, particularly during the early stage of the pandemic, when reported cases were few, but whenever someone was diagnosed with the disease, there was rumor, and that there was they were kind of socially ostracized, and other people didn't want to have anything to do with them. So there was quite a bit of stigma surrounding the disease initially, because often they thought this is coming from outside. So it's not a disease that they are vulnerable to, but it is coming from outside. So whoever who came from outside, for instance, in Sri Lanka, quite a number of our labor force is actually working overseas in different categories of employment, particularly in the Gulf region. So some of them came back after the onset of the pandemic. Some of them were retrenched, but they experienced a great deal of discrimination and social ostracization when they came back. We talked to some of them over phone, and they felt that they were discriminated while they were working abroad because they were migrant workers. But when they came home with the expectation that they will be well received because they have been sending remittances to their relatives throughout their work overseas. But they felt that they were treated very badly, not only by strangers, but even their family members, neighbors. So there was quite a bit of social stigma surrounding the disease initially. But that situation again changed over time, partly because almost everybody got infected, or somebody from their families or network got infected. So the situation changed. as part of my education teaching, I ran a course on advanced research methods, and one of the assignments I gave to my students was to do what we call autoethnography. They record in their own personal experiences during the pandemic. So they often reported, this phenomenon that, like in their workplace, in their home areas, and even in public transport, people were like, of course, they maintain social distancing, but there was a kind of fear to talk to strangers, and all the kind of niceties about social interaction disappeared during that period, so to speak.
Yeah, well, those are such, great challenges. And it seems as though your knowledge about these issues is really kind of important for us to hear about. So thank you. Thank you so much for speaking about that. And kind of looking forward, what comes next for you and your research and your work in these next 6 months? And maybe, if you could speak a little bit also about what kind of comes next for your community as well. What do you think the future looks like?
Okay. Well, now the incidence has decreased substantially. Mortality is almost like zero at this point in time. So people are happy about it. But Sri Lanka also suffered economically a great deal during the pandemic, sometimes due to pandemic-related causes, but also related to other causes. Like the leading sources of foreign income in Sri Lanka were tourism. People come into Sri Lanka as tourists from various countries. So that was completely disturbed by the pandemic, and so we lost one of the most important sources of foreign income. And the other one I already mentioned, Sri Lankans working overseas, inward remittances sent by them was a very important supplement to household income, and also nationally it was important contributor to foreign earnings. So that also was disturbed. So as a result, even though the pandemic ended or pandemic is ending right now, the economic repercussions are continuing. And actually now the problem is not so much the pandemic, but how to restore these income sources, particularly tourism. How to rebuild tourism, and how to encourage people to send more remittances to the country remains an important challenge. So as a result of these disturbances, the economy has actually run into serious problems. There are food shortages about essential commodities like petrol and diesel, and LP gas used for cooking, imported, and the country doesn't have enough money. And also the debt crisis in the country increased substantially. So economy has almost become bankrupt in recent times. So the current challenge is how to overcome this problem. So we on the one hand, we have to deal with the pandemic, and on the other hand, this economic crisis. So my work right now, actually, we are trying to develop kind of research project looking at that, and how people deal with this problem, and what are the ways in which income sources can be diversified, not limited to these two activities, and also trying to basically understand the lessons learned from both these crises. Because in the case of Sri Lanka, economic crisis and the pandemic actually were closely interconnected. So now we are at a point where pandemic perhaps has become less of a problem, but the economic crisis continues to affect. So how people deal with it and its impact on poverty, like food consumption, food security, these are important issues to be explored. So in my next kind of research project, I will focus on that issue.
Wow, well, it seems as though your work is only continuing to move forward and, really take steps in the direction that the trajectory of the pandemic is moving in. So that's really great to hear. And, just in general, thank you so much for sharing your perspective, Professor Kalinga Tudor Silva. And we really appreciate hearing more about your work and your research, and also a bit more about the effects of COVID-19 in Sri Lanka. And just thank you so much for your time and all of your efforts related to the pandemic. And it sounds like you're kind of continuing that research. So thank you so much.
Thank you, Emily, and good to talk with you.